Hello, hello. What if I were to tell you that you don't have to struggle with neurodivergent cases, that there are practical strategies and tools that you can use to make myofunctional therapy even more effective for that population base? Would that be helpful to you? If so, you're going to love everything that we're going to talk about today, because today we're diving into Myo for every mind. And so, let's start out with our nice warm welcome. Give me a hi, hello in the chat. I'm so happy to be here with you. My name's Carice Laguerre. I am a myofunctional therapist, a thought leader in the space. I do myofunctional therapy 100% full time. I teach. I am here for you. Any questions you have, I'm happy to answer. And we do these lives pretty regularly. Now, it's been an exciting summer, and I've been enjoying some of it, maybe a little too much with my family because I haven't been here with you in a couple of weeks. But no worries. We are here and we're going to get back on track to keep this going, make it a weekly thing. Now, these lives, they are packed full of information. And I'm telling you, there's already over 60 hours. We are actually nearing towards 70 hours of education on all things myofunctional therapy, but it doesn't happen consistently. So if you want to make sure you never miss a live, make sure that you subscribe if you're watching me on YouTube. If you are watching on LinkedIn, make sure that you're following me or connect with me. I love to connect. You are more than welcome and highly encouraged to share, because the more professionals, the more people we have practicing with excellence, the better off everyone is collectively. Professionals, the public, we all can be doing so much better. So this is how we can keep this going. Just engage with the content. All right, now that we've gotten through all of that, we're diving into neurodivergence today. Okay, so neurodivergence is something that I think people are very confused about. Like, what is neurodivergence? What exactly does that mean? Does that only pertain to autism? Does that only pertain to ADHD? Does it only pertain to dyslexia? It actually pertains to a broad spectrum of things. Neurodivergence is really just a different way of processing information, a different way of absorbing things that are around you or interactions, how you interact with the world. It's a way that your brain operates that might not be very common. Okay. And so it can be any number of things. It doesn't necessarily have to be an official diagnosis, you'd be surprised to know, but it doesn't make it a disability. It is not something that is, not something that is a requirement for you to have to work extremely differently than how you typically would work. In fact, a lot of neurodivergent strategies are really good for even the neurotypical and can actually help to make you just more effective as a practitioner. If you're watching this as a parent or a person who is neurodivergent and you're trying to figure out how myofunctional therapy might be helpful for your child, I think some of these strategies might be good for you to take note of as well, just to know how myo can work in different ways and how you can gauge your questions as you're looking for a practitioner. Do you find somebody who is most ideal to work with your child? So, neurodiversity, an umbrella set of terms. It can include ADHD, it can include autism spectrum disorder, it can include dyspraxia, dyslexia, dyscalculia, it can include a number of things, okay? It's essentially a spectrum. So it can go from one end to the other. There are some people who are very mildly neurodiverse and others who experience a broader set of neurodiversity, and they may have multiple ways in which their brain, does not communicate in the same way or does not receive information in the same way. Now, this could also, in fact, impact social interactions. So it makes it very, very interesting to navigate, because some are going to express exceptional abilities where you'll see a higher rate of creativity. They will come up with new and interesting ways to do things. And so you might find that during sessions as a practitioner, sometimes they'll come to you with their own analogies, their own ways of doing a exercise. They may have had a new creative name or description for how they do a particular exercise. They might be able to draw it better than they can articulate it. They might be able to perform it better than they can articulate it. The creativity might be thriving. Their ability to recognize patterns is typically better if you have a neurodivergent person. Being consistent and maintaining certain patterns are really, really good. It's a way for them to know what to anticipate and to be able to work around you. And so you'll be able to work better for them and with them as you're going through a program, because their pattern recognition is so acutely attuned to like whatever's happening in your sessions. And then problem solving. I like problem solving with anyone who's neurodivergent. Sometimes I'll ask questions and they're not anticipating for them to be in charge of what happens next. And so I think asking questions, allowing them to make decisions and to problem solve or troubleshoot with you is actually really, really good. They can be exceptional. But then there's some ways that they're a little more different, where sensory processing becomes an issue. And sensory processing is incredibly common in the work that we do, right? In myofunctional therapy, we're oftentimes dealing with people who have sensory issues around certain textures, or maybe they have some types of oral aversion and they're averse to maybe touch, perhaps even, and we can't quite get the work that we want to get done. And so we have to navigate sensory processing issues. They have difficulties regulating their emotions, difficulties with social interaction. And so even your approaches need to be fine-tuned to a neurodivergent population. And you have to be adaptable. If you're not adaptable, that's okay. Working with neurodivergence is not for everyone, but for those who are willing to put forth a little extra effort, it can actually really like make your therapeutic process blossom, absolutely blossom and thrive. So like I said before, it's a spectrum. It's any number of things. Not everybody's going to have, exceptional creativity. Not everybody's going to have difficulty with their emotions. It's a broad spectrum of things upon which you can expect. And the best way to know is to ask. The more questions you ask, the better everything is. So when you're doing an intake, when you're doing an evaluation, and you are bringing them into your world, into your practice, into how you operate, you want to have all the information and data that you can. So ask if there's any neurodivergence and where the shines are, where are they brilliant, and where are the areas of, I don't want to call it a weakness, but where are the areas where, we need to focus. So where are the areas that we might have some challenges in? Neurodivergency by the numbers. I think this is really, really important. YouGov did a really interesting poll, because that's what it was a poll, and they got a really interesting response where like 19% of the people polled within America identified themselves as some form of neurodivergence. I think as people become more aware of neurodiversity, you start to understand the ways in which you yourself might not think like others. And so it's interesting to find that maybe 1 in 5, because it's roughly 1 in 5 at 19%, might feel that they experience some type of neurodivergence. And it's interesting because if you think about 1 in every 5 of the people that you meet in myofunctional therapy might be neurodivergent, that makes this all the more important to talk about. And that's why I really wanted to highlight some of the statistics around this, because on average, 15 to 20% of the US population is considered to be neurodivergent. So some self identify and others actually are. There's a good 7 to 10% in the US that have been diagnosed with or self identify with ADHD, so attention deficit hyperactivity disorder. A lot of adults, it's trending. I don't want to say that it's trending in a way that some people might be identifying, but without an official diagnosis, you're only self identifying, and it's trending based on the symptoms. It's really important to note that some of the symptoms, especially in children, overlap with those of sleep disorders and insufficient sleep. So, when you're sleep deprived as a child, you'll manifest some of the same things, a lack of focus, hyperactivity, and so forth. You'll manifest some of those same things if you're sleep deprived or if you have ADHD. So, because there's such an overlap, it's incredibly important to be aware that 7 to 10% of the population could be actually diagnosed or might self identify with many of the symptoms of ADHD. 3% of US children 8 and younger are diagnosed with autism. It's a much smaller percent that might be recognized in the media, and that number is direct from the CDC, the Center for Disease Control. And so in the US, it is a rather small population, but again, it is an umbrella term, neurodiversity, neurodivergence. Having a different way of thinking is so much more than autism spectrum disorder. And 17% of children ages 3 to 17 have been diagnosed with some form of a developmental disability that would be considered a neurodivergence, such as calclia, dyslexia, like the reversal in the head or the inability to really in the brain see letters or numbers in the way that they're organized, and so it might just process differently than it would for others. So it's something very common, and it's likely that you're seeing this especially in OMT, mostly because sensory processing disorders very common in what we do. When people ask how many people do I see with tongue tie, I think it's a very skewed thing because most of the people who are referred for myofunctional therapy learn and research on their own and get themselves to a myofunctional therapist. Most of these people already have a lot of what would already be correlated with having a tongue tie. So I'm going to have a higher population of those that do have tongue tie or express concerns with tongue tie than a traditional, let's say, than a occupational therapist, who might not be looking for this, or a feeding therapist who might not be looking for it. And so who knows, but sensory processing disorders very, very much are prominent in our field. We're seeing a lot of them. They're everywhere when it comes to OMT. Repetitive behaviors or habits, particularly those of the negative oral fixating types, having fingers in mouth, putting objects in mouth, sucking, biting, bruxing, these repetitive habits or behaviors and how they happen in a lot of neurodivergence is very likely to cross over into OMT and emotional dysregulation, which oftentimes we put together with autonomic dysregulation. And whether it's dysregulation, there is absolutely 150% going to be somebody heading the way of myofunctional therapy. And so, with that crossover, I think it's important to understand that there's a beautiful opportunity here to be open to the idea of learning new strategies, tools, tips, techniques, and ways to work with the population that is neurodivergent. And so, if you're ready to dive in, dial in, and let's get going. There's 3 types of practical strategies that we're going to go over today: sensory and environmental adaptations you can make, communication and instructional modifications, like for exercises, how you can communicate more effectively with those who are neurodivergent, and then session aids and techniques. And so let's just start first with sensory, and setting. The setting is incredibly important. Now, I will say that as a person who has practiced a multitude of ways, I've practiced inside dental offices. I consult and help to put it in dental offices currently too. So I see that significantly. I have a home office here that I've made very sensory friendly, and I go into homes. So I do home mobile based therapy where I will travel to my clients and work within their homes. And so, as somebody who is very fluid in the ways that I can practice or how I can create a setting around myofunctional therapy, I'll tell you that being very adaptable to sensory integration and how you can either dial up the senses or wind down the senses is incredibly important. Being mindful of your setting, being mindful of who you're working with, also incredibly important. You're going to get more out of a person if you're in an environment that they can work well in. I will say that I don't identify as neurodivergent, but I do have a very strong sensitivity to like bright lights. Like if your phone is at the brightest lighting setting, my eyes, I just can't. Like, don't show me any videos on your phone. I just can't. I've had offices that I've worked in as a hygienist in the past where it's the brightest setting, and I always have my op like at half the lighting because I just cannot do that full lighting thing. And so if I was to come in to a space where I had to work and it was a clinical space, the very first thing I want to know is, can we adapt these lights? Like, does it have to be this bright in here? Is the first thing that I want to know. And if that is something that can be changed, then yes, that works great for my sensibilities. I'm going to be able to thrive in that kind of space. If I don't have the ability to do that, or we can't make any shifts or any changes, then all right, but I'm probably going to be annoyed the whole time I'm there. It's going to be in the back of my mind. It's just so bright in here, and I'm not going to be able to fully focus. And for some who are neurodivergent, like the sensory impact of the setting really does matter. So this is an important topic. Okay, so take it as seriously as you can. You want to be able to be consistent with how you are structuring everything, but certainly what goes on within the setting for myofunctional therapy. It's going to set the stage. So, what's the flow of treatment? What is the flow of a session? How do I know when we're done? If you give me a clear beginning and a clear ending, or even better, if you have something that is going to just visualize it for me. So, this came out of the Myo Excellence Toolkit, which is a fabulous adjunctive aid for anybody who's in the Myo Pathway Comprehensive Myofunctional Therapy course. But this is just one page of a sample visual schedule where you're able to see, okay, so we're starting out the session and we start it with the basic exercise. We'll talk about that in a little bit. Then we're going to review the homework or whatever it was that they had that was their prescribed regimen of exercises or activities. Then we're going to get on the vibration plate. Then we're going to learn some new exercises. Then we're going to review and end. That seems very clear. You know how close we are to ending by where we are, right? So if we're on reviewing homework, are we done yet? Are we done yet? Well, we still haven't done our vibration plate. We haven't done our new exercises. And only after we review can we end. Okay, so it gives a set flow to follow. You could also put this with time. The basic exercise typically for me is less than 3 minutes. Some people take a little longer, and that's okay. But if I put on a timer, I can do all of these things 30 minutes, have everybody in and out. Basic exercise, less than 3 minutes. Vibration plate for 5 minutes, typically no more. Reviewing homework, ideally, I want that to be less than 10 minutes between new exercises and review. We can do that with the last 15 or so minutes that we have in a 30-minute session. And so if I have a timer on, like I have a big sand timer in my office, we can put the sand timer on. We can also use tools such as ALEXA. I don't want to say it out loud because something's going to start listening, or SIRI, or GOOGLE that we can always call on to and say, hey, set a timer for 30 minutes, and you'll see that countdown quite visually. And that visual aid, being able to follow it and being consistent with maintaining the timing for it is ideal. That is the best way to get as much cooperation, as much trust and rapport building as you possibly can from someone who is neurodivergent and really does require that consistency, that transparency, and that trust to be built. So you want to stay on time. You want to make sure that you're getting through everything and, follow through. Now, I have one of those poppers, but I have a bracelet and it's got like the little bubbles and you can pop the bubbles. I forget what those are called, but you could pop the little bubbles. So there's 10 bubbles on it and I'll give the bubbles like a meaning. And so like, okay, we're starting and here's your bracelet and we're going to do 10 different things. And after we've done all 10, you get to pick a prize and we're all done. So when I go to people's houses, this is the best way for me to keep track of everything and make it timely. So I might give one of the bubbles to us just reviewing. I might give one of the bubbles to us practicing an exercise, but then we need to stop. We'll redirect. We might change tasks. We might start the basic exercise. All right, so we've tried an exercise. We're going to pop a bubble. Then we're going to do the next one. And we're going to take a sensory break. We'll pop a bubble after our sensory break. So that's 3 so far. I know that I have 7 more to go. And with that, I'm able to kind of keep myself on track and they understand, they can see it visually by popping the little bubbles that are on their bracelet that, okay, this is what we have. And it's one of those little push bubble things where like you push the bubble and it goes to the other side. So we can easily just like reset it for the next time. And so they keep the bracelet. And it's a really cost effective way for me to be able to get people on board when I'm not in a structured setting that is of my own design. So for those of you who are mobile or who work in alternative settings, that's a fantastic way to keep everything moving and going. It's also important that in your setting, you're able to have a way for them to be in charge of what happens in there. So having the ability to make at least 3 decisions allows them to be more in control. I have sensory things such as little balls, stimulation balls in on the floor. I typically have pads. So I have a grounding pad. I have a like foot stimulation pad. So it's just really like textured. It's really textured in a Boso pad, and it helps provide additional proprioception. And so like you get to pick which pad are you standing on today? Are we sitting? Because then I have a little rubber band, and that little rubber band they could kick around and they can get their stimulation in that way. Or do you want to stand on the vibration plate while we do such and such exercise? Like having the ability to make 3 of the choices really leads to, okay, I feel like I was pretty much telling Miss Carice what to do during this appointment, and like they leave feeling much more confident. So make sure that you can give them some sort of choices, even if sometimes it's just the choice, like the example I gave earlier of like how much lighting is in the room. Can we dim the lights? Or can we do this with the lights turned off? And then you can always get party lights or uplighting of certain colors, uplighting that changes colors, and then you can uplight the room and have maybe it be a yellow room, and yellow might be the favorite color, and the lights are all down and it is just a little bit illuminated. So we're not sitting in the dark doing Myo, but we're in control of the color and the ambiance so that it's not overwhelmingly flooded with light. So more or less light, more or less sound. Sometimes people like a little sound in the background. If you have the ability to play music, if you have speakers in your walls, if you have speakers, if you just have like a regular speaker, you just have a computer and you just play some background music. And some people really, really like that and they thrive better with that. Or just the colors and how much color there is is in the room. You might have a more sensory stimulating room and a less sensory stimulating room. If you have the ability to have multiple rooms, what room do they want to work out of? Being able to have that choice is key. Okay. You want to provide things that are going to help them feel like they're in charge of sensory stimulation. So, would you like to sit with the weighted lap pad? Weighted lap pads are like a smaller version of a weighted blanket. And I can't tell you how much I can't live without my weighted blanket. Like, I need my weighted blanket to be able to go to sleep. When I travel, sometimes I just do not get good sleep. It's just something that is very comforting for me. Since I've discovered lap weighted pads, it's been a game changer. So we have a lap weighted pad and you can just put it down and they will sit. They will sit and they will be more attentive. Some of them even have sensory tags or sensory let's just call it tags, projections off of the lap pad. And so it's just extra little things for them to play with that might make different sounds or just be more prone for fidgeting and for stimming. And that's great too. Do you want them to have a squishy ball so that they can squeeze that while they're working with you? Little poppets, little poppers, or even just having colors for your timers. So my timer is very brown and bland. I like the color brown, so I don't mind. But having like a pink 30-minute timer or a 15-minute timer, or you do the 5-minute timer and we know that we turn it for 6 times. However you want to do it, make sure you're providing something that can be engaging visually to keep them in and keep them on, or engaging in a way that is going to be calming and allow them to give you their full participation. I also like to stimulate to start. I mostly like to start with the basic exercise, and we'll talk about that again in a minute. But the vibration plate is also a great place to start. A lot of times, if I'm seeing people in my home office, that's first 5 minutes, shoes off. You come into Miss Carice's office, your shoes are off. You can have socks, but I prefer if you're barefoot because you're going to be on my pads. So get on the vibration plate. I love a vibration. I have a Life Pro. I love it if it vibrates in at least 4 planes. So it should be able to give them like a back and forth. A back and forth, a side to side, and up and down, and an oscillating. So it should be moving in a way that you can't really tell what you're doing other than you just feel the vibration. And then we do something static while they're doing that. Now, as a mobile therapist, how can I also do this too? A lot of people have individual, like a little one person, like the little boy in the yellow top in this slide here, have individual trampolines. If you have like a trampoline with whatever, we can jump on the trampoline and they can get that engagement also. We can also do the bouncy balls. The seats that I have in my practice are the yoga ball seats. So they would sit on the ball, and you really have to be more mindful of your posture. It's really hard to sit on the ball if you're slouched forward, right? You can't quite do that in that same way. And so being able to stimulate gets a lot of what I like to call, or what I like to say, the sillies out. So you get those sillies out and you move along. That way we're able to now carry on with what we have to do. It's not necessarily the sillies now, right? Or sometimes if I'm at a home, I will ask, like, hey, do you have any of these things, or can we do something fun? And oftentimes there's some way for us to do it, or we jump around or run. Like, just do a lap. Just do a lap. We'll do something isolating when we do it. So a cave hold, just holding the suction, tongue to spot, maybe holding a rubber band, a Cheerio, or something up to spot while you're doing it, getting that proprioception between the tongue and the palate to be engaged, making sure that we're doing our quiet breathing. So we might just take a life stick. If you know what this is, then you know what this is. For most people, it's a tongue depressor, but you take your life stick and you put your life stick in, and we can do our passive proper oral resting posture, then awesome. So we'll do something static while we stim, and then that's going to be the best way to like get all the sensory stimulation out of the way to start. Okay. Awesome. Moving on towards communication and teaching styles. So, like, how can you adapt your program and your communicating of what you're trying to achieve in sort of teaching an exercise or teaching an activity to meet the needs of the neurodivergent? Well, make sure you keep your language incredibly simple and very, very clear. Don't get too clinical. Spot for me is just that first bumpy spot right behind the upper front teeth, that first bumpy ridge. So you take your tongue, and I just want you to touch the back of your upper front teeth. You're going to slide across the roof of your mouth. You feel those bumps? Oh, yeah, it's a little bumpy right there. Like bump, 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 smooth. Touch your teeth, go back, bump, 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 smooth. Yeah. All right. Awesome. So what we're going to do is we're going to take our tongue. We're going to touch the back of those upper front teeth. And then I want you to slide back ever so slow. We're going in the slowest motion ever. Really, really baby steps slow to that first bumpy ridge. Stop. As soon as you started, you're pretty much stopping. That first bump, you feel it? That's spot. Let's get accustomed to spot. Spot is that first bump behind the upper front teeth. Like, I don't make it anything overly complex. It's not like, I'm trying to give them a certain number of millimeters or something to be aware of. It's just a first bump, something super simple. Okay. Messages get lost when you try to be clever, when you try to be cutesy and have like little fun things like, oh, we're going to find Mr. Spot, and Mr. Spot, he is 1, 2, 3 steps away from the teeth, and it's too much. Just go something easy, clear, communicate without any sort of guesswork. I shouldn't have to figure out how you are alluding to something. It should be so simple that like a third grader can get it. And if you're working with people who are neurodivergent and less than in third grade, then it should be so simple that a preschooler would understand it. Like, what's a bump in the mouth? What's a bump, period? If you can understand what a bump is, then that first bump behind your teeth, awesome. Like, that's as clear and simple and easy to understand as literally anyone at any age could probably grasp. So don't worry about getting clever, okay? You might have some fancy ways that you describe things. If you're working with adults, sometimes that might work for them too, but the average age of communication that you should be aiming for, honestly, in everything that you publish and everything that you put out for marketing, social media, whatever, 5th grade. Like, that's the reading level. Try to be as simple as possible. It doesn't make you look any smarter. It just makes other people feel not as adequate. So go simple, keep it simple. Okay. All right. Anytime that you give a directive, there might be a pause. And if there's a pause, it's not for you to repeat what it was that you said again. It's for you to just wait for just a second, pause with your client, and allow them to process what it was you just said, and then they can respond. So if you're asking them to do a certain task, give them a second to respond. Did you understand what it was that I just asked for you to do? Sometimes the answer is no, I don't get it. That's okay. You can break it down into smaller steps. I like to break everything down into like very clear steps. So step 1, we're going to open wide. Step 2, we're going to put in our mouth prop. Step 3, we're going to like lift our tongue up to that special spot. So that it's, what's step 1? Open big. What's step 2? Put it in the mouth. Step 3, lift our tongue up to spot. Awesome. Take it out or reset, and then step 1, and you could do it all over again. What's the harm in taking it out each time, starting over? There's no harm. It just takes a little bit longer, and that's okay. You want to follow the pace of who you're working with. A lot of times I can get very excited and I can start talking really fast, but if who I'm talking to is not somebody who can process what I'm saying as fast as I am communicating, then I need to slow it down. I need to bring it down. And so you want to get down to their level many, many times, especially as a traveling myofunctional therapist where I do the home treatments, I am on people's floors. I get down to their level or lower. Okay. I am not the expert in the room. I am not responsible for anyone ever getting any sort of gains or goals. People tell me all the time, oh my gosh, I'm so thankful. Like, thank you so much. You've been so helpful. Mm-mm. You did all the work. Okay. I come, I provide you with a little bit of guidance, but then you do all the work. So everything that I do is to make myself smaller, make them bigger. And so get on their level as you're talking, as you are doing anything. You want to get down, be on their level. If you're sitting, don't sit in a chair that's higher. Get down and make sure that you are eye to eye for any sort of communication or below their eyes for any sort of communication, slowing down your pace, maybe even talking a little lower. I hope you could still hear me, but there are times where I've done a whole session and we whispered. Why are we whispering? Oh, because, you know, mom told me that the baby's sleeping and I always have to whisper when the baby's sleeping, or I don't like loud noises. I want to wear my headphones. That was supposed to remind me of the headphones thing. I want to wear my headphones and I just can't process it if you're going to speak really loud. All right, let's whisper. I know that that's what we do. We match their tone and where they are. So be adaptable, okay? And in being adaptable is always being quick on your feet because there's going to be distractions. There's going to be moments where even when we're trying to follow the flow of our consistent appointment where it's like, I just really want to get on the vibration plate. I want to do that now. Can we do that before we review? Okay, we could do a little bit. So we can get on the vibration plate for a minute. And if we're going to get on the vibration plate for a minute, I want to see one of your exercises while you're doing it. Awesome. So we could redirect, we can get where you want to go and where I want to go at the same time, and then come back on track. So you just follow whatever distractions or whatever delay is happening. Sometimes there are even some, like, I don't want to call it a tick per se without it, being fully a tick, but there might be certain things where they might be picking or scratching or like, what happened? Oh, my arm, it itches right here. It itches right there. Okay, well, let's both focus on this. Why is it itching right there? I don't know. Did you get bit by a bug? No, I don't think so. Are you sure you didn't get bit by a bug? Did you get bit by your little sister? No, that's so silly. Oh, okay. Well, that's good. I'm glad she's not biting. Did you get bit by your dad? Oh, no, that's Miss Carice. Come on, you're being crazy. Oh, okay. Well, you didn't get bit by anybody. You didn't get bit by a bug. Awesome. Very, very good. I'm so glad to know that that area is going to be okay. Do you think we can try again for that exercise we were just working on? Oh, okay. We just move on. So I will follow that path of distraction and we'll come right back around and we'll get to where we have to go. You got to be adaptable. Okay. When you're teaching, feel free to use puppets or models. I am not very good at this, okay, especially for being outside. Mobily, I used to carry a bigger bag than I carry now. And in there, many of you who might follow me on social media, which I'm not very good at, but follow me on social media, might have seen this puppet. I love her because she has this great tongue, and the tongue I can move around and whatever. And it used to be how I would talk through or talk to some of the patients or clients that I'm working with, because as I'm talking to them, maybe I'm not getting through. But you know who can get through? Gia can get through. Like, she's my little puppet. She can get through. And so she's talking and she'll ask for something to happen. And sometimes she might even be my face. So she's in front of me. She's like, let's put Miss Carice aside and whatever. So you can talk through a puppet, or you could use it just for demonstrations and just for whatever other purposes. You want to engage sometimes the parent in a task. So if you're working with a child who's neurodivergent and you cannot get a certain skill and they don't want any form of touch or any sort of physical cues by you, stimulating directly, well, I always ask if the parent can do it. Sometimes things get very frustrating, they get very emotional, and at that point it's like, okay, it's hard, I get it. Look, if it was easy, you wouldn't need me to be here. So let's see if mom can do it. And if we get a parent to do it, 9 times out of 10, the parent can't actually do the task. And so they see that it's not just hard for them, it is also hard for someone else who's in the room. You're not alone. This is very challenging. Miss Carice, don't use me as a bar of measure for anything. I do these things all the time, all day long. I'm doing these exercises. I've gotten really, really good at them. And so mom can't do it, you can't do it, your little sister can't do it, whoever can't do it. It takes time. You'll build up to it. But how do we get better? We just keep doing it again and again and again. And so engaging sometimes someone else who might be in the room in the task and asking them to attempt and or having them be the person to do the physical cues is really helpful. Like I mentioned before, dividing into very clear steps, any sort of task always helps provide more clarity in teaching. And then establishing sort of any breaks that are needed. So it's really helpful if you're able to break down into some sensory breaks. We've got our squishy ball, or you can jump on the trampoline if we do 5 more tries of this particular exercise. And you got to count it down, and you have to be very clear, and you have to make sure that you are honest in how you're approaching it. Okay. So is it 5 good tries that are perfect? Or is it just 5 attempts? And if you've tried it and you've tried your best 5 times, but we didn't actually get the performance of the exercise down, or you're trying to make a clicking sound and you just can't get it, but you've slowed down, you've taken it into clear steps, and you've made an effort 5 times, then yes, you can go do the vibration. Awesome. Then take that sensory break, come back and regroup afterwards. That way you can put it aside, try something else, and then move forward. Okay. Neurodivergency also requires you to be adaptable in how you approach what should be very much structured. It's a very helpful. All right, aids and techniques that will help you to have more seamless and smooth transitions as you are in your therapeutic programs. I love the basic exercise. So Stanley Rosenberg wrote the book, The Healing Power of the Vagus Nerve. Yes, it is a fabulous description of the polyvagal theory. And in there, he has different exercises. What I would say is that I highly recommend you read the book. But if you're unfamiliar with the basic exercise, there's lots of videos with a lot of different people who put the basic exercise out there. Now, that first picture in the last slide was a little girl with a pillow, mostly because I have a pillow that has a washable cover, or like I can wipe down the cover, but I also have a lot of different pillowcases. So we'll just put a new pillowcase on it. They will lay down, they will have their hands intertwined with each other, back of the head, lying down, and they're going to look all the way to one side until I get a really good like sigh, or I see a change in the breathing pattern. Then we're going to come center before we go the other way. I was going to play this video. I don't think I have the time to play the video, so I'm really about to skip through it. But you can find this video and videos like it where they will go over the basic exercise. What this does is this helps to reset the nervous system. So if they're unable to socially engage, if they are hyperactive in any type of way, all of the time, hyperactive, ASD, autism spectrum disorder, or just inability to emotionally regulate or socially interact, we're getting down, we're getting a pillow, pick your pillowcase, we're going to do the basic exercise. I do it with a lot of adults that self-identify as neurodivergent with ADHD. It really does help to set the session. And so sitting down or laying down and doing the basic exercise is like the best technique or therapeutic aid I can give, and I give it to a lot of people. Like, please just do this one thing. It's like night and day. Some parents have asked, should I just do this at home? Why not? Do it at home as you need it. Now, when you overdo something, that's going to make it less effective. But if you really need it, like prior to doing any exercises at home or prior to doing some of your routine, if they really need it so that they can focus, it really does help. There have been lots of instances where they come in, they're super wired, they're all over the place, like really all over the place. And then we get down, do the basic exercise, and they're sitting so still, it's scary. Okay. So just be prepared for the amount of shock that you might get from that. It's a great technique. Okay. On top of that, also know that therapy doesn't have to be seated. I'm very known for being adverse to that and saying to a lot of people a lot of the times, like, hey, you don't need to have people sitting. I think Myo should always be standing, but it doesn't always have to be standing either. Feel free to alternate it. It can be, let's sit, let's do this for a little bit, then let's get up, let's move our bodies. The body is a whole unit. A lot of myofunctional therapy is really just saying, hey, the body is all connected. So actually connect the body. Don't just focus on the fine motor movements. Connect to the fact that they have legs that can be moving while you're doing a particular exercise. That if you have a proprioceptive mat, such as an Oboso mat, or you have a grounding mat, like the one that I'm sitting on. I guess I have my feet on it while I'm sitting, but if you have a mat that can help them regulate in some way or achieve a different type of proprioception, it's really helpful. It really is actually helpful. If you don't have one of those like textured or electric mats, then what you're going to do is you're just going to use a yoga mat or a gym mat. I found several gym mats from places like Goodwill or Restore. It's a fabulous place to find like really cheap. I think the last one I got was $1.50 for like one of those foldable gym mats that you would find in like a elementary school gym, those colorful thick mats that you might find in an elementary school gym that they will pull out on days where they're doing certain things, certain floor exercises or floor things. Just use one of those mats and have them do some activities while standing. It doesn't have to be expensive. It doesn't have to be complicated. Okay. And create stations if your space allows. Some people are working in a very narrow space. Some people are able to have big spaces where they can move a little bit more freely. If you can move a little bit more freely, create different stations. Or if you're at a desk and you can create stations within the desk, that's awesome. If you can have 4 bins and then one bin is a sensory bin and that's where they can pick a ball to squish or play with or whatever while they're working, and then while we're working we can put it down in a bin, and then you know that there's another bin coming and there might be kinetic sand or something else in there, and there's a little play station where you can kind of do some play while we're doing something that's more passive, like maybe doing some quiet breathing or testing the breathing in proper oral resting posture. While they're doing that, they can be in active play in the kinetic sand. And then while they're reviewing, maybe there's a final station where they can take that sensory ball that they've put down at that workstation and bring it over to the last bin where we know that we've done our review. And when the ball has made the full transition through the bins, then yay, that's how you know that you're done. Or you can create stations within a larger room that you're in. So you might have a sensory station with a bunch of different things. You might have those sitting yoga balls. You might have regular balls, bouncy balls, a vibration plate. You might have anything in that little sensory area. A workstation. I used to have a section of an area where I worked in a dental office where it was play. We had games, like pick a game, whatever game you want to play. Do you want to throw a ball? We could throw a ball. We can play Connect Four. We can whatever. Like there's a PlayStation and we can play in this area. And while we're doing it, in order to do such and such, we have to actually be working. And so I need you to try this exercise XYZ amount of times, or if you want to do 2 plays in Connect Four, like you want to drop 2 of your tokens, you want to drop 2 of your tokens in, then we're going to have to really be good at such and such exercise. And then you might just beat me a little faster. I don't let anybody just win in Connect 4, by the way. Review station. And then the review station at the end, like, how do we just clear this all up? Maybe we sit down and we review all the exercises, or we give time for writing notes and so forth. So you can make it so that it's structured in a way that is positive. Okay. So a lot of times people look at these sort of things, they're like, oh wow, you're speaking strictly to the providers. Like, what do I do with this outside of that? I'm not a provider. I have clients who've told me that they watch these videos that I put out, and they just want to know, like, what do I do at home, or how does this apply to me as a parent or as a person who is neurodivergent? um, you got it. I am not going to ignore you. Okay. I've got strategies for how parents or people can take this outside of the office. How do you adapt myofunctional therapy for home when you're neurodivergent? Well, really important that you're consistent as possible. So, whatever times you're doing it, if you wake up first thing in the morning and you do your myo exercises, make sure that that's what you do every day. You wake up as many days as possible. You know, you might wake up one day and you feel totally congested, terrible, woefully ill. All right, fine. We don't do our myo exercises that day. But the next day that you wake up and you feel great, guess what? Myo exercises. Like, when you do them should remain consistent. Where you do them should remain as consistent as possible. So if you wake up and the first thing in the morning is you sit up or you go to your vanity and you do your exercises, well, make sure that you do your exercises later on in the day when you do them again for another repetition, because most of them are to be done 2 to 3 times a day. When you're doing them again, it's at that same vanity. Keep it consistent. So with the same respectful consistency that you would maintain in office, maintain that at home. It's incredibly important. Duplicate the tools as best as possible. The families that have loved the vibration plate, that have loved being able to have the bouncy balls, like, get one of those in the house. That's going to be wonderful. They're going to do more of that and a little less of the stimming or some of the negative activities that we don't like. So whether there is an oral habit or something that is in the way and that's causing us to not be able to engage in the same manner upon which we would like to engage, we need to duplicate those tools that are working well in office at home. Okay. Use the exercises that are videotaped to ensure that you're doing the same task, to ensure that it is as accurate as possible. I apologize for whatever that error in spacing is there on this slide, but I always do homework sheets now. I used to not do homework sheets. I used to have all the exercises pre-printed. Now I'm adapting to the needs of every single person that I work with. And so I create homework sheets that adapt to the different needs of the people that I'm working with. So notes or homework sheets to ensure that you're doing it very accurately, or videotape the sessions. Some providers also do have their own videotaped exercises that they provide you with, or there are apps where they do that, and so forth. And then check in when you're not sure. I tell everybody that I would much rather you bother me, because it's never a bother when anybody that I'm working with, any client reaches out. But I would much rather you bother me by reaching out and saying, hey, I'm still unsure about this exercise, or am I doing this right? And you send me a video. That way I can correct you, instead of you spending a week or two or more doing it wrong in repetition. So always check if you're unsure. Sometimes that's a part of neurodivergence, is that you don't have that memory accuracy that you think you have. And so you need that additional help and support. Tap in with your therapist as much as possible. Okay. No one expects perfection from patients or from practitioners. Nobody's going to be perfect. We're all walking the same journey in life. And so, really, any bumps in the road, it's okay. We're all learning and growing together. As you are starting to think about implementing these things, I think it's really important that how you communicate them to your population as a therapist or as a practitioner is incredibly important as well. So, while you're starting to implement things. I don't think anybody expects you to be perfect in them, but you still should communicate that you do have enhanced and adaptive methods of working with neurodivergency. You have such and such sensory stations, you have Niboso mats, a you have bouncy balls, you have things that are special strategies that are able to help neurodivergence kind of hone in and get through as well as possible. Any sort of concerns that caregivers or anybody who is neurodivergent might have, make sure you address those. Sometimes it's just, will you be able to talk to my speech therapist? Will you be able to talk to my occupational therapist? Like, I have a full team. Can you adapt well into the team? How do you communicate with these people? You have to be a willing participant in communication as a myofunctional therapist. So more often than not, you are already adept to working in teams. And so you're just going to express that and express that as eloquently as possible. Okay. And then any sort of, other outcomes that you can facilitate working with neurodivergency, like make sure that you are communicating that. I think it's incredibly important for the other side of the coin. If you're listening to this as like a general public person or somebody who's interested in starting myofunctional therapy, for yourself, a child or a loved one who is neurodivergent, well, then you probably need to reverse some of this and you're going to ask some questions. How do they improve the comfort and the success for neurodivergent patients? Is there any adaptations or strategies that they implement to adapt to that population and so forth? Make sure you're asking the right questions, okay? And then whatever you do, just make sure you start. Actively implement something. There's nothing worse than getting new information, being like, yes, I'm going to do something about that, and then doing nothing. So, like, start small. Pick 2 things from this lecture that seemed like they're doable for you, even if it's just getting like little sensory balls, or it's creating a flow chart, or it's having a timer, something. 2 things, and implement them literally today, or whenever you're listening to this, the next time that you're going to, see a client. Implement something different or start asking new questions. I think that's probably the best thing that you can do, is start asking new questions. You'll get better answers when you start asking about things. So even if it's just asking them, is the lighting here okay? Are the sounds okay? Is there something you would change about this room that would help you feel more comfortable? It's a great question to ask. Okay. But whatever you do, just start. It doesn't have to be big. You don't have to make major shifts in your whole program and how you do things and in your room. Just start. Start with something. Okay. I'm going to tap in and just check and just make sure that there are no comments. I don't see any comments. I don't see any questions. And so I am always happy to answer. Just throw them in the comments. If you're watching on YouTube, throw them in the chat if you're watching on LinkedIn. And I look forward to seeing you again at the next one. Until then, remain excellent and exceptional in your therapeutic process. It was a great time. Bye, friends.